Setzer.
Yeah,
Correct. Hi guys, welcome back. Today is day 2 of presentation. We are very busy at the moment, and then to be live with you, we have a very two important guest with us. We have Dr. Frank Setzer. Ciao Frank, how are you doing? You okay?
Ciao, very well.
Okay. And then Professor Gianluca Gambarini. Come stai?
Molto bene.
Okay, great. So I want just to introduce you Frank. Frank is an associate professor of University of Pennsylvania, professor of endodontics department, and I want to ask him, I know that your interest, research is around CBCT images, artificial intelligence application in endodontics, in microsurgery, so very interesting, very hot topic. So can you just clarify in few words how is this point in endodontics?
That's a very good question. Thank you for having me, by the way. So I have an active collaboration with researchers from the Arizona State University and Georgia Tech, and we're looking into the diagnosis and detection of periradicular lesions, with our future goal actually to be to identify other types of jaw lesions, to really give endodontists and other general practitioners helping hands in identifying lesions they otherwise might overlook.
Very interesting. And then if in case of you want to apply this technique in microsurgery?
So artificial intelligence in endodontic microsurgery has several applications in the future. We're not there for all of them. Number one is the lesion detection and diagnosis I just talked about. One will be very important in terms of differential diagnosis between cysts and granuloma, because this might be one of the issues where we might want to decide between a non-surgical and a surgical treatment approach. Then we will be looking forward to some robotic applications, augmented reality, which will be driven by artificial intelligence.
Oh, that will be interesting to understand or to know if there is something to do surgical or root canal treatment, if we know the lesion, the quality of lesion. We have here Gianluca. I'm very proud to have Gianluca today, because has been now president-elect from ESC. Gianluca is from Rome, professor at Department University della Sapienza in Roma. So just introduce you a few words, because it's not necessary too much. Gianluca, how are you?
I'm fine and happy to be here and speak about artificial intelligence. Tomorrow we will present a symposium. Actually, the symposium is divided in two parts. One is the endodontic app for diagnosis, and the other one is the use of artificial intelligence for diagnosis and for other things in endo, also for the clinical practice, because I was chairman of the clinical practice. And in order to say, for example, what's the main difference between an app and artificial intelligence for the endodontic diagnosis, I would say that an app, and we have a few ones, including the one from the American Association of Endodontists, that the dentist put the images, or see the images, and by using the app help him in making the diagnosis. On the other hand, the data input for artificial intelligence is totally different, and depending on the source of the image, it can be 2D or 3-dimensional. The neural system of the artificial intelligence can make a diagnosis. So in a certain way there is less bias, because the images goes directly from the machine, the radiographic machine, to the artificial intelligence, while in the app. But anyway, the app are now, some of them, quite popular, and they're still very young and very new, and we are promoting this. But I think also in artificial intelligence, there are some new software coming on the market in the last couple of years. So everything is very, very new, but it's very interesting. And I want also to know what Frank thinks about this.
I do absolutely agree. We will see great changes actually coming to us in endodontics, in general dentistry as well. I think one of the foremost applications that we will see based on the applications you just described is that we will see forecasting and prognostication of cases. So this is something we've already seen in a couple of papers at this point. It's surely going to be integrated in some of the softwares where we actually take not only radiographic images, but also patient information, age, information about the tooth, dental history, medical history, and it will give us an idea how successful our treatments will be. So I think this is going to be one of the drivers for AI in dentistry actually, and for endodontics in particular, besides the other applications that I mentioned before.
I have something to add about this, because this is a very important point, because I mean, everyone agrees on a certain way about the importance of the artificial intelligence in diagnostic, and we will obviously take benefit of this because the machine is never tired. The machine is always looking at all the details. Actually, in the software that are currently on the market, you have some feature that allows still the dentist to give his own opinion. So he has to confirm what the artificial intelligence says.
So I think this is an extremely important point, because we know that there is obviously some issues still with artificial intelligence. It generally is still a very young technique in terms of research and science. And we know there could be inherent biases in the data that had been processed by the AI to train and then to validate, and we have to be aware of this. And sometimes we don't even know how AI comes to certain conclusion. It's like a black box for some of the algorithms. So we're trying to have initiatives out there, not us per se, but the entire research community, such as transparent AI, to understand algorithms, how the AI comes to certain diagnostic predictions. And then in general, we want to have the human in the loop. We want to make sure that everything is not just trained, validated, and tested, which is the three most important steps in AI algorithm development, but you also want to put that tuning step in between, that the AI is always getting new input from the human to make those corrections. And we're not ending up with hypothetically devastating results because AI might give us a completely wrong diagnosis because of the inherent problems that there may be there.
This is, we speak because it's a very interesting topic, and to make things even more simple for those who are listening, actually this was an issue was carried out, for example, with social media, artificial intelligence with Facebook, and the Facebook used artificial intelligence to decide what was decent and publishing a post or not. But obviously this one depends on how the algorithm is made, and also by the people who design the article that may have a different way of thinking, different behavior. So I think, this was a problem with social media, but it's, let's say, a lighter problem when we think about human health and diagnosis. That becomes a way more important issue.
And then we know how is important the diagnosis for an endodontist, for dentists in general, but for endodontists it's very important. So I understand that it's a young technique. My question for you is, what do you think in the future will be the further improvement in endodontics?
So definitely what I talked about before, we certainly will see augmented reality. The AI is going to be driven to help us doing live surgical procedures. We will see robotics. We talked about it before for certain procedures. In endodontics, we've seen some applications in implant dentistry at this point. And this is something that will actually, I know it's going to happen very soon, going to be seen in endodontics as well.
Yeah, the other thing, and this is a very, very delicate topic, is that since, as Frank mentioned before, artificial intelligence could not only be used for diagnosis, but also for prognosis. So it means that artificial intelligence may suggest treatment planning and maybe insurance or maybe medical issue. could be related to artificial intelligence. So the possible risk is that the artificial intelligence becomes the major factor driving all this issue, which is something that some people who fears a little bit, and also in some countries, especially in the US, I think they also, because I saw some programs in which the artificial intelligence can tell you whether you have to refer a tooth to a specialist or not. So this, there is a little bit of concern about the limitation to the clinical practice that are from the artificial intelligence.
Yes, yeah, we hope that the role of endodontist will remain the main one, because it's a bit scared to listen about something like that in the future. But very interesting, and I really hope we maybe see you next year in 1 year, Gianluca.
Well, one year we will have the auto meeting in Krakow, and it will be a very interesting meeting because we will discuss in the guidelines, the clinical application of the S3 guidelines, and also the research implication, because there's still a lot of research missing in endodontics, and we want this research to be done in the next years.
So fantastic, and I would say thank you, Frank, to stay with us. Grazie, Gianluca, and guys, see you at the next live su YouTube. Stay with us. Ciao. Thank you.
Ciao, ciao.
Ciao, prego.